Hello, everyone, and welcome to the launch of the 2025 Global Report of the Lancet Countdown on Health and Climate Change. My name's Daisy Dunn. I'm Associate Editor at the climate publication Carbon Brief, and I'm delighted to be the host for today's event. I covered the first report from the Lancet Countdown in 2017, which warned that climate change is the major health threat of the 21st century. The report is now in its ninth edition, and it offers more detailed findings than ever, which will be explained by our expert speakers in today's session. Before we begin, there's a few housekeeping notes. So this event is being recorded and the full recording will be available on this platform and on YouTube shortly after the event. For those of you joining live, you'll find several tabs on this platform, which includes the report itself, some speaker bios, and additional resources that you can use during and after the event. If you have any questions for the panel, you can submit them via the Slido Q&A box or on LinkedIn. We'll aim to address as many as possible during the session. If we run out of time or we need to offer a more detailed response, we'll follow up via email. Finally, we're using the hashtag LancetClimate25. If you're posting on social media, please include it so that we can amplify it. Before we hear more from our speakers in today's session, I just wanted to give a bit of context around the launch of this report. So today we are living in an era of extreme weather and extreme politics, both of which have consequences for human health. As we meet today, Jamaica has just faced its most intense hurricane on record, serving as a reminder of how the people who have done the least to cause climate change are often on the front lines of its deadly impacts. In just 2 weeks, country leaders will gather in Brazil for the COP30 climate summit. It's billed to be a major moment for countries to assess whether their climate plans will be enough to stop dangerous global warming. However, analysis by my publication, Carbon Brief, shows that 2/3 of countries have not yet submitted their climate plans for assessment, leaving the path forward uncertain. It will also be the first UN climate summit to take place since the Trump administration has resumed power. It's still not clear if the Trump administration will attend the summit and what the impact of this could be. Turning back to the report now, to open today's event, we're honoured to hear from the Right Honourable Helen Clark. Helen is the former Prime Minister of New Zealand and the former head of the UN Development Programme. Helen also serves as chair of the Lancet Countdown board. So welcome, Helen.
Greetings, everyone, and thank you for joining us today. It's my pleasure to be welcoming you to this launch of the 2025 Global Report of the Lancet Countdown on Health and Climate Change. As emissions of global heating gases are breaking previous records once again, this year's report finds that people are facing unprecedented threats from climate change to their health, their well-being, and their survival. Against this concerning backdrop, global governance and multilateralism are being challenged, while geopolitical conflict further undermines much-needed global cooperation. Then, alas, there are those in governments and the private sector who are adding fuel to the fire, backsliding on previous climate commitments made, and in some cases even denying that climate change exists, despite the strong scientific evidence to the contrary. Delivering urgent, meaningful action to tackle climate change is a matter of life or death for many, and action is ever more urgently needed. This year's Lancet Countdown report shows that the fight is far from lost. It provides evidence of the enormous health benefits we're already getting from that climate change action which has been delivered. It documents the growing leadership of local governments and in civil society, private sector, and the health sector itself. These are building momentum for bold and ambitious action to tackle climate change. Overall, the report offers the evidence we need to inform further action from actors across societies to deliver the healthy, thriving future we and those who come after us deserve. I'm very pleased to be chairing the board of the Lancet Countdown at what is a moment of opportunity. Action on climate change really is one of the greatest health opportunities of our time. By rapidly phasing out fossil fuels, investing in clean energy, transforming our food systems, building resilience in our communities, we could save millions of lives a year, support healthy economies, and deliver a happier and more prosperous future. I know that this clarion call is echoed by many of you here today who've pulled together to lift ambition and action at COP30 and beyond. So let's strengthen this resolve and work together to turn our vision of a healthy and prosperous future into our reality. Thank you.
Thanks to Helen for that clear message of taking action for people's health. So our next keynote speaker is Dr. Tedros Adhanom Ghebreyesus, who is the Director General of the World Health Organization. Under his leadership, the WHO has taken a leading role in connecting climate and health. Last year, we saw this in the WHO's release of the COP29 special report on climate and health. And as we look forward towards COP30 in Belém, it's my pleasure to welcome Dr. Tedros to this event.
Dear Richard, dear colleagues and friends, WHO is proud to be a core partner of the Lancet Countdown. I thank Dr. Marina Romanello and the Countdown team for their work on this powerful report, which offers a clear direction for climate and health action. This year's report provides the clearest evidence yet that the climate crisis is a health crisis. 12 of 20 key indicators have reached record levels. Heat-related deaths have increased by more than 20% since the 1990s. Wildfires, droughts, and extreme heat are driving hunger, displacement, and disease. These are not future projections. They are a daily reality. The report also offers hope. It shows that when countries cut emissions, build resilience, and protect people, health improves. Every policy that reduces air pollution, strengthens early warning systems, or invests in clean energy saves lives now and builds security for the future. WHO is supporting countries to take action. The WHO Global Action Plan on Climate Change and Health provides a shared framework to help countries develop stronger systems, better data, and sustainable finance. We also lead the Alliance for Transformative Action on Climate and Health, or ATTACH, which unites 100 governments in developing climate-resilient health systems. At COP30, this work will come together in the Belém Health Action Plan co-developed with Brazil. The plan focuses on surveillance and early warning, workforce capacity and innovation, and listening to the voices of the most affected communities, women, children, indigenous peoples, and low-income communities. Thank you all once again for this report and your partnership and commitment to making health the most compelling reason for climate action. I thank you.
Thanks to Dr. Tedros there for an update on what we can expect on climate and health at the COP30 summit coming up in a couple of weeks' time. Our next keynote comes from the Right Honourable Julia Gillard, the former Prime Minister of Australia, now Chair of Wellcome, which funds science to solve the urgent health challenges of today's time. The Lancet Countdown was established in partnership with Wellcome, which provides core financial support. We now welcome Julia Gillard.
Hello everyone. It is a privilege to join you today for the launch of the Lancet Countdown's latest report, a vital and urgent assessment of how and to what extent climate change is harming our health. On the 23rd of July this year, the International Court of Justice, the world's highest judicial body, released a powerful and unprecedented advisory opinion on the legal obligations of countries to address climate change. 27 law students from the Pacific Islands sparked the global legal campaign that led to that ruling. The impact they have had is overwhelming. It is an important reminder that small actions can have big consequences. As the case developed, scientists, diplomats and lawyers worked together to ensure that scientific evidence, particularly from the intersection of climate change and human health, was robustly integrated into countries' submissions. It really shows the power and impact science can have when collaboration involves sectors and actors from across society. The Lancet Countdown is the global scientific authority on this issue, and Wellcome is proud to support it. As you will hear, this year's report not only deepens the evidence, but more than ever, ties scientific insight to policy and action. Let's build on this momentum. Every international negotiation, every national policy, every local intervention, they must all put health and science at the centre of climate action. We have an important role to play to make sure that happens. 2024 was the first full calendar year to exceed 1.5 degrees of warming. The World Meteorological Organization forecasts a 70% chance that the next 5-year average warming will also breach that threshold. The warnings we've all heard for decades have become facts, the reality for all of us. Inaction is costing lives every day. This year's Lancet Countdown report details the devastating consequences of surging heat-related deaths, wildfire smoke, fossil fuel air pollution, and it doesn't stop there. Our changing climate is eroding livelihoods, straining economies, and undermining health systems. As you digest the data, remember these are not just statistics. They are the stories of families, communities, and futures lost. But amid the sobering truths, there is hope. Science shows us the path to a healthier, more resilient future. Countries and communities that lead on climate action will reap the health and economic benefits. From clean energy transitions that could prevent millions of deaths, to climate-resilient farming practices that safeguard nutrition and livelihoods, the solutions are there. They are evidence-based and already making a difference. But solutions only matter if they are implemented at scale, and we are nowhere near that reality. With COP30 on the horizon, we have a unique opportunity to reframe the global climate agenda around people's lives and to inspire action. So this report is more than just a warning. It is a roadmap. It provides actionable insights for governments, cities, health systems, the private sector, and civil society. It's all here, but we need to get smarter at using the data to engage people and drive change, especially those who don't agree with us. Let it inspire us to move faster, push further, and work together at COP30 and beyond. If we act together with health at the heart of every climate decision, then a healthier, sustainable world is within our reach. We can't afford to settle for anything less. All our futures depend on it.
Thanks to all our keynote speakers today. We are soon going to move on to hear about the findings of the 2025 Lancet Countdown report. But before we get to that, I'd just like to remind you that we will have a panel of experts available to answer questions later on in this session. So please feel free to use the Q&A box to enter any questions that you may have. So now I'm delighted to introduce somebody who's going to tell us a lot more about the findings of this year's Lancet Countdown report. So Dr. Marina Romanello is the Lancet Countdown's Executive Director. This year, she brought together 128 experts from over 70 academic institutions and UN agencies to come up with the Lancet Countdown report. We're delighted that you're joining us to hear firsthand what the latest evidence is showing. So thank you, and over to you, Marina.
Thank you so much, Daisy, and special thanks to the Right Honourable Helen Clark and Julia Gillard for those powerful statements. Particular thanks also to Dr. Tedros and the WHO, whose work has been so fundamental to the work of the Lancet Countdown as well, and to the progress that we've seen so far on health and climate change globally. I'm gonna now run you a bit through the findings of our latest Lancet Countdown report, which just got published earlier today, and whose title is Climate Change Action Offers a Lifeline. This year's report is the 9th of the iterations, the annual iterations of the Lancet Countdown. It presents 57 indicators, each providing a data point that we track year on year to monitor the evolving links between climate change and health, from the impacts of climate change on health through to the health benefits delivered or that could potentially be delivered through ambitious and health-centered climate action. And while I'm here giving the presentation, the work that I'm going to show to you is the product of enormous efforts and dedication of 128 experts from the 71 contributing organizations that you see on screen, with each indicator being a small research project from world experts in its own right. And this report was once again delivered in close partnership with the World Health Organization, as you just heard. The main finding that comes from this year's report is that delays that we've seen so far in taking action on climate change have already claimed life and are claiming millions of lives every year worldwide. The threats of climate change to people's health have once again reached very concerning records, and we see that across the scope. Going to perhaps the most evident aspect of climate change, the rising temperatures. We know that exposure to high temperatures, exposure to extreme heat, is particularly dangerous and even potentially lethal for those vulnerable communities and populations, including elderly people and very young children, including those with underlying chronic health conditions like heart disease, lung disease, and neurological conditions. It also puts pregnant women at risk. It puts the pregnancy outcomes at risk as well. And what we're seeing is that exposure to extremes of heat is growing globally. We estimate that over the past 5 years, people on average globally were exposed to 19 days of health-threatening heat waves, and that 84% of those days of exposure would not have occurred were it not for the climate change that human activities are generating. This exposure to heat is increasingly costing lives. And for the first time in this year's report, we now quantify the death toll of heat exposure, estimating over 500,000 deaths occurring annually from exposure to extreme heat, at a rate of mortality that has increased by 23% since the 90s. And obviously, heat-related mortality is just the tip of the iceberg. We know that behind each of these deaths, we have a huge burden of disease. Now, the higher temperature, the drier weather condition, and the changing rainfall patterns are also leading to other health hazards, including the rising risk of incidents of wildfires. And people on average are now exposed to about 6.6% more days of high wildfire risk globally than they were years ago. And we're seeing that exposure to wildfire smoke, wildfire-derived PM2.5 air pollution, is leading to 154,000 deaths. This is the first time that we're actually able to quantify the death toll from wildfire smoke, a death toll that has increased by 36% since just a few years ago. The changing weather patterns are also leading to changes in the environmental conditions that make the weather more suitable for the transmission of infectious diseases in new parts of the world. I'm giving you here an example of one of those diseases, dengue, but we have many more in the report that I invited to look at, including the impact of climate change on the transmission potential for malaria, for leishmaniasis, from chikungunya, Zika, West Nile virus, and vibriosis. And we see similar trends across all of these diseases that we track, that the distribution of disease is being affected by climate change. And we now see more people being exposed to diseases which they were traditionally not exposed to, with health systems having to cope with diseases they're not prepared to face. In the case of dengue, the transmission of dengue by the two main mosquitoes that transmitted, Aedes albopictus and Aedes aegypti, has grown by almost 50% and over 10% respectively since the 1950s. And you might have heard we had an unprecedented outbreak of dengue in 2024, unprecedented number of cases that we know climate change at least partly fueled. And we're seeing these type of trends across most of the indicators that we track. I often get asked, what is the most concerning finding? And the single most concerning finding of the report is what you see on screen, that across every one of the indicators in which we're monitoring the health threats of climate change, we see conditions getting increasingly more dangerous for people all around the world. What you're seeing on screen in that heat map, in that colorful heat map, has each indicator plotted in a horizontal line with its values normalized such that bluer colors mean better conditions for health and red colors mean worse conditions for health. And it's clear to see that trend towards rapidly worsening health conditions across the scope. Even more concerningly, we see that 65% of the indicators that we monitor have once again breached record new levels of threats to health in the latest year of data. And this is worrying because it means that we're not just being exposed to individual hazards, but we're being exposed to growing hazards of climate change on health that are happening simultaneously. Our bodies are having to face multiple simultaneous impacts, and our health systems are at the receiving end of rapidly growing hazards all across the scope. What this tells us is that we have not yet adapted successfully to climate change. There's much more to do in terms of strengthening our health systems and reducing the death toll and the burden of disease from climate change. And adaptation to these current levels of heating could be very efficient in protecting people's health. However, it keeps on being underfunded, and we now have new data also in the report on the gap of adaptation for health adaptation funding. But when we talk about the cost of delayed climate action, it's not just about the direct impacts of climate change on health, but also about the unnecessary death, the unnecessary suffering that comes from our inaction, from our slow transition away from fossil fuels and towards healthier human systems. And for example, we see that happening in the agricultural sector. The agricultural sector contributes to about 1/4 of all greenhouse gas emissions, and about 55% of its contributions to planet heating greenhouse gases come from the production of red meat and dairy products. And on the other side, we see that the overconsumption of red meat and dairy products is responsible for a big burden of disease, and that our low consumption of healthy plant-based foods is also leading to death toll around the world. Unhealthy high-carbon diets altogether lead to almost 12 million deaths every year, of which 1.7 million are associated with excessive consumption of red meat and dairy, 6.1 million from insufficient consumption of healthy plant-based foods, deaths that could largely be avoided through transitioning to healthier diets that are also low carbon and could help reduce the impact of our agricultural sector on the planet and the environment on which health depends. Turning to the energy sector is the biggest single contributor to climate change. And we have technologies, we have the means to decarbonize, to eliminate the emissions from our energy sector. And yet, even today, we're seeing emissions from the energy sector have reached a record new high level in 2023. Some preliminary data shows that 2024 broke yet another record. And 81% of all of our energy still comes from fossil fuels. 27% of that from coal, a very polluting, very health-harming source of energy. And while we have made progress in adopting clean renewable energies, as you see on the right, this progress has been incredibly unequal and unjust. Countries with lower Human Development Index levels, or HDI, are lagging in the adoption of these technologies, which could be made available off-grid in remote locations, could help tackle energy poverty, and are now cheaper and more accessible than fossil fuels. In contrast, very high Human Development Index countries are leading the way in the development of these technologies, with 13.3% of their electricity generated today from renewables, which means that the development gap, the gap in the adoption of the technology of the energy of the future, is widening globally. And why that matters for health? Well, it matters mainly because of energy poverty and the associated health harms. Ambient air pollution from the persistent burning of dirty fuels, particularly fossil fuels, leads to 2.5 million deaths from outdoor air pollution each year. And you can see on the graph in the left where this comes from. Coal burning from power plants, industry, and households is still a major contributor to death from outdoor air pollution, whilst liquid gas is still by far the biggest single contributor when used for transport, particularly the burning of petrol through our cars, especially happening in urban centers, exposing people to toxic air. In terms of household air pollution, we still see people around the world being dependent on dirty fuels and technologies to meet their energy needs. And what this means is that because of the lack of access and deployment of clean renewable energies, people keep on burning solid biomass, coal, and other health-harming forms of fuel inside their homes, leading to very high levels of toxic air pollution and an estimated 2.5 million deaths in the 65 countries that are still most suffering from energy poverty. Deaths that could be avoided, again, by transitioning to clean energy that is now cheaper than fossil fuel-based energy and can be made available in remote locations. So these are some of the kind of direct deaths that come associated with our insufficient efforts to transition to low carbon diets, to healthier energy systems. But the persistent dependence on fossil fuels has other very adverse effects that harm our health also indirectly. As a result of the fossil fuel prices having spiked over the past few years, countries around the world turned to very expensive, very costly subsidies to fossil fuels to keep energy affordable to local communities and to avoid a spike in energy poverty. What this means is that countries around the world have spent a net total of almost $1 trillion in net subsidies for these health-harming fossil fuels to keep energy affordable locally. Subsidies that could be avoided by transitioning to cheaper and more locally available sources of energy, like that from renewables. These are funds coming from national budgets, often already overstrained. And in fact, we see that 15 countries allocated more resources to subsidizing fossil fuels than they did to their total health budget. It's clear to see how these resources could be reallocated towards activities that benefit human health, towards better access to safe, zero carbon, zero emission energy, and to improving overall health and well-being. It's important to know that while these funds are delivered to subsidizing fossil fuels, adaptation and the protection of health keeps on being grossly underfunded. So the picture so far is very grim, but the most concerning finding in the last year of data is that we're seeing backsliding on climate change action across key actors around the world, increasingly putting people in harm's way. Adaptation being underfunded is becoming an increasing problem, and with the backsliding of commitments, adaptation will become increasingly costly, increasingly challenging. This reversal of commitments is posing unprecedented threats to human health, to human lives around the world. And once again, in a nutshell, this is what the picture looks like. When we look at the indicators on which we monitor the actions that are being taken around the world to tackle climate change, we see that 60% of our 20 metrics are moving in the wrong direction, making conditions worse for health. And of those, 6 indicators, 30%, show a reversal of progress that was done in previous years. To give you a flavor of what that looks like, and perhaps where this is coming from, we've seen key global leaders in the US with Trump, in my own country in Argentina with Milei, reversing on previous climate commitments. And engagement of key leaders with the intersection of health and climate change is falling. The prioritization of health and climate change in global political agendas is dropping. And we measure this through a reduction in mentions of this topic in the UN general debate. And with falling interest, with falling pressure and falling commitments from key global leaders, we're also seeing backsliding of commitments from private sector organizations that are key to tackling climate change. Most importantly, the fossil fuel sector. We're seeing, once again, fossil fuel companies dropping their climate commitments and expanding their oil and gas extraction and production strategies. This comes from what they declared themselves to their own shareholders. According to what they declared in 2025, they are now on track to exceeding the emissions compatible with a 1.5-degree world, with the commitments of the Paris Agreement to make the world a safer place, by 189% by the year 2040, up from 183% the year before. Each year, they keep on expanding their bets against our health and against our future. And they're not doing this alone. They're receiving a lot of financing and a lot of support to expand their activities. Private banks had been decreasing their lending to the fossil fuel sector for 4 years in a row. Since 2015, they had reduced year on year their lending to the fossil fuel sector and increased their lending to the renewable energy sector. And yet, in the latest year of data, we've seen that the main banks around the world have increased the lending to fossil fuels, supporting and financing that expansion of the fossil fuels that are ultimately putting our health at risk. Fossil fuel sector financing has increased by 29% to $611 billion in 2024, now exceeding all the lending to the green sector, obviously a trend that is undermining our future as well. Amidst all of these very concerning findings, and amidst some governments and some key actors globally turning their back on the very robust body of science showing the health threats of climate change and the huge opportunities of climate action, we do have good evidence in this year's report about the life-saving benefits of climate action, and show that climate action now offers a lifeline amidst this turmoil. We see that those countries leading the transition are increasingly enjoying the benefits of climate change to the health of local populations and to local economies. The deployment of clean renewable energy, as I said, has not been nearly fast enough to displace fossil fuels, but we have seen record high productions of clean renewable electricity in 2022, growing really fast, as you can see on the graph on the left, to 12% of total electricity. And that has come hand in hand with an expansion of the renewable and the green energy sector. The net zero economy, the so-called net zero economy, was responsible for 10% of all of the GDP growth in 2024, a substantial contribution to economic well-being. And as you can see on the right, it's also leading to the net generation of jobs and new employment opportunities, which are generally healthier and more sustainable than employment in the fossil fuel sector. Employment in the low carbon energy industry has increased to 16.2 million jobs in 2023. And in contrast to this, even as fossil fuel giants expanded their production plans, employment in the fossil fuel sector fell by almost 1% to 9 million jobs in 2023. This is further evidence, and we have other studies that show that each unit of investment in the renewable energy sector generates 3 times more jobs than that in the fossil fuel sector. So when it comes to healthier economies, which are essential for good health, we know that betting and investing in the zero carbon economy is the way to go. Now, we're seeing huge benefits already delivered also to health. I already mentioned we are seeing about 2.5 million deaths from outdoor air pollution, and we're not transitioning away from fossil fuels even fast enough. But what's important to note is that the very minimal progress that already has been delivered has yielded enormous health benefits. We estimate that 160,000 deaths were avoided every year through the phase down of coal use, particularly in the wealthiest countries. You can see there in Europe in the map how it's been benefiting from healthier air, primarily because it's been reducing its use of coal. And that shows just the enormous potential of a transition away from dirty fossil fuels. We have already delivered so many lives saved. We could deliver so many more, up to 2.5 million, through a robust transition away from fossil fuels. And the other encouraging findings in the report is that we see that while some world leaders are backsliding on climate commitments, momentum is increasingly building through bottom-up action from grassroots, local organizations, and the health sector, building momentum for a global transition despite falling commitments from some world leaders. We see this very clearly when we look at cities. Cities and city officials are closely in touch with their local community. And through reports from cities to CDP, to the former Carbon Disclosure Project, we see that cities are increasingly engaging with climate change and increasingly engagement with health in climate change. 97% of cities now report having completed their climate risk vulnerability assessments, which are fundamental to drafting a robust and evidence-based response that can protect the local populations from growing climate hazards. And many cities around the world are also now starting to deliver the health benefiting decarbonization efforts that we need to see globally. We also have in the report examples from impressive action happening from grassroots organizations, organizations where action is being led bottom up. And we have examples of individual civil societies increasingly turning to litigation to keep governments and corporations accountable. And what we're seeing also is that individuals are increasingly getting interested and engaging with the intersections between climate change and health. We monitor this simply by looking at their activities on Google. And we see that Google searches of health and climate change increased by 21%, which is fundamental. This engagement from people, this interest from individuals is what then drives action to tackle climate change, grassroots organizations, and ultimately collective action. And finally, turning to the sector that is closest to us, the health sector, we've seen impressive leadership from health professionals worldwide. Healthcare sector emissions have fallen by 16% from 2021 and 2022. And this was mainly driven by improved use of resources following the COVID-19 pandemic. And largely because of the support and the efforts of the World Health Organization, we're also seeing that World Health Organization member states are increasingly assessing their health vulnerabilities and developing health national adaptation plans, drafting the roadmap towards delivering improved healthcare for local populations in the face of climate change. So this year's data reveals very clearly the life-saving potential of climate change action. We see the evidence and we see how much has already been delivered. But we're also seeing the backtracking of climate commitments, putting lives, health, and livelihoods on the line. And as we see this, we find that protecting people's lives can lean on this bottom-up action and now requires all hands on deck, every effort from every action to make this possible. And with that, I thank you so much for your attention. Special thanks to welcome to the Lancet, who are incredibly patient with us as we publish these reports every year and make it all possible, and to UCL's Institute for Global Health for hosting us. And with that, I will now hand over to my friend and my colleague, Professor Stella Hartinger, who leads the Lancet Countdown Latin America, and they're now publishing their annual indicator report as well. So over to you, Stella.
Hi, Marina. Thank you for the invitation. I'm so happy to be here. And yes, we're publishing the report in a couple hours. So this is just like a 5-minute quick overview of what's happening with us. So I'll just present the key messages and invite everybody to come later this evening, if you can, to the launch of the Latin American report. So just quickly, what's happening in the region? Well, what's happening in the region before COP, no? Because this year is actually very important for us. So unfortunately, we have insufficient climate plans. The Latin American countries' national determined contributions remain still low. Mexico and Argentina, unfortunately, has not presented their NDCs. We have weak implementation and enforcement through the plans and agreement, and the effective execution of these plans are still remaining quite low for us. We have expansion of fossil fuels happening in the region. Despite international commitments, several governments continue to promote fossil fuel expansion, like what's happening in Brazil now. And I think it's going to be a moment of importance to talk about this. So the narrative is moving, solely focusing on adaptation rather than adaptation and mitigation strategies. Deforestation and loss of carbon sinks for the Amazon and other forests continues to be the loss of vast areas. Many countries have high deforestation rates and lack clear targets in their NDCs to curb it, exacerbating the region's emissions. And unfortunately, the environmental human rights crisis in Latin America has become one of the most dangerous regions of the world for environmental defenders. particularly against indigenous leaders. So this is the framework where we are in Latin America. So a lot of work to move forward. In the report, we have three key messages that mirrors what Marino just presented for us so eloquently. So the first one is that addressing climate change is essential to protecting human health. The escalating intensity and climate hazards, including heat waves, droughts, and wildfires, is creating cascading health risk and economic shocks across the region. What we're seeing with heat waves is becoming more frequent and more severe in the area, affecting children and older adults, with an increase of 100% in mortality and a 52 billion increase in economic losses due to heat-related reduction in reward capacity. Droughts and wildfires have multiplied across the region, causing significant economic damages. Extreme events have increased the number of wildfires almost in 26%. And unfortunately, 20% of the Latin American territory has experienced at least 6 months of extreme droughts, an increase from 18% when we compare it to our baselines. Droughts and wildfires have multiplied across the region, causing significant economic damages. But the problem with us is that less than 5% of these damages are insured. The increase in temperatures has greatly increased the potential for dengue transmission of Aedes aegypti in the region of around 66%. This is already endemic in our region, as you can see, much higher of what the global is actually seeing or tracking. Our second key message is that adaptation is no longer optional, it is essential and non-negotiable requirement. A multi-level strategy that reduces climate risks, accelerates resilience, and addressing existing socioeconomic inequalities must be prioritized. Actions at the highest level, government and national policies, remain inadequate in our region, indicating a failure to prioritize health resilience. We see lack of political momentum in Latin American countries as well, that exceeds the international forums and funding. However, we do see that the NDCs are increasing incorporation equity concerns. But limited countries, we wish there were more, have limited progress in their planning and adaptations, and less half of them has completed the vulnerability assessments, and only 9 over 17 countries have national health adaptation plans in place. As well as a global, health is appearing less frequently in international discussions, with only 2.3% of climate funds are directed specifically towards health and adaptation. So we have to look at the local and communities levels and also see what's happening there. We have urgent need to translate high-level climate commitments into tangible local action, and this is what we're focusing on. We have seen an increase in climate risk assessment at city level. However, this still remains a bit low if we consider the amount of cities that are actually responding to this. And we see it because many of our cities in the region show very low levels of green overcoverage. Despite that, other social societies, what Marina was also mentioning, has increased in the reporting of climate change risks. Finally, our third message talks about the effective and integrated climate and health governance must be defined by tangible progress. As what's happening globally throughout Latin America, funding that supports just energy transitions and collective climate actions remain critically low. A key factor driving is the region's continued fossil fuels dependency. Latin American countries exhibit a next negative carbon price, reflecting a substantial net fossil fuel subsidy of around $38 billion. Although solar and wind energy has expanded, the share of low carbon energy sources in electricity generation has decreased, and land transport remains almost entirely dominated by fossil fuels. The burden of indoor or ambient air pollution are also quite high in the region. Our particulate matter concentrations from pollutant fuels for cooking and heating is quite high and surpasses the WHO recommended guidelines. 14% of our population still relies on biomass fuels for cooking, and unfortunately now 75% of our population uses LPG or fossil fuels for cooking, making the transition even harder now. So just a small call for action of what we should be thinking or what we see, what the Belém COP represents for us in Latin America. The loss of the Amazon and other forests continues to be our biggest source of greenhouse gas emissions, and we must focus on them. We must think about transitioning the transformation of the food systems through mitigation strategies like regenerative agriculture. And it's key for us to achieving both climate targets and immediate health co-benefits. The COP30 opportunity in Belém do Pará rapidly approaches, and Latin American countries have a unique opportunity to champion tangible, health prioritized climate adaptation and mitigation strategies. I will stop here because in the afternoon we will have more to talk about, but please follow us and try to join us for our event. Thank you.
Thank you to both Marina and Stella for laying out so clearly both the health risks posed by climate change and also the evidence showing that fossil fuel industries are not yet taking the steps that they promised to make in order to transition to renewable energy. So we're going to move on now to today's panel discussion. Each year, the Lancet Countdown is published in the Lancet Medical Journal. It's my pleasure to now invite the Lancet's editor, Dr. Richard Horton, to facilitate today's panel discussion. So over to you, Richard.
Thanks so much, Daisy. It's great to be with you again this year. I always feel that every year the quality of the Lancet Countdown report gets better and better, which is a real tribute to Marina and her absolutely fantastic team. But I think this year it's a real highlight to have Stella present with the Latin American Countdown. It's just incredible to see the development of the regional countdowns. It's a really, really important innovation, led from the center from Marina, who's been pushing for this for a long time, and supported by Wellcome. Really fantastic work. Now, we've got a great panel for you, and we're going to put some tough questions to them over the next 45 minutes. So let me introduce our team. First of all, Laura Clark, who is the Chief Executive Officer of Client Earth. Then Dr. Mariangela Simeão, who is the Secretary of Health and Environmental Surveillance at Brazil's Ministry of Health. Dr. Raji Tajuddin, who is the Deputy Director General for Africa Centers for Disease Control and Prevention. A well-known face to many of you, Dr. Jeremy Farrar, who is Assistant Director General for Health Promotion and Disease Prevention and Care at WHO, man with the longest job title, but was formerly Chief Scientist at WHO before that reincarnation. And the star of our show today, Marina, is also joining the panel. So what I want to do to begin with our panel is to get you to give your immediate reactions to what you've heard. So take a minute or so to give your first thoughts. Why don't we start with Laura?
Thank you, Richard, and huge thanks to the Lancet Countdown team. It's such a privilege to join this panel, but also to sit on the board of the Lancet Countdown. It's really clear in the report and from these presentations that we're living in an era of climate consequences. Heat waves, floods, pollution, drought, diseases, they are no longer distant threats. They are here with us now with devastating consequences. And climate inaction is an escalating health crisis. So one of the questions that I think about a lot is, how do we translate evidence like this into real world action that makes a tangible benefit to human health? And the law can play an incredibly important part in this route to impact. It can clarify the obligations of states and corporates on tackling climate change and protecting human health. And critically, it can hold them accountable for their failures and for the damage done. It can also help make a reality of the right, which was declared by the UN General Assembly in 2022, to a clean, healthy and sustainable environment, because I think we're all clear we are a very long way away from that. So litigation on the climate, health and human rights nexus is growing at pace. Client Earth has, over the years, supported community groups in bringing legal action to tackle air pollution, pollution from agriculture, for example, and to hold governments accountable for their human rights obligations to tackle climate change. What we need now to really clarify obligations are two types of cases, two types of litigation. Firstly, cases that confirm the obligations on states to protect life and health from the adverse effects of the climate crisis. That in turn leads to positive obligations on climate adaptation, for example, and protection for vulnerable groups. And secondly, we need cases that really raise the stakes for polluting industries, that really make a reality of the polluter pays. And as attribution science strengthens, drawing that connection between emissions and human health impacts, we're going to see more and more class actions and damages claims against big polluting industries, which, when they scale, will change their calculations and change the business models and profitability of such industries. So this report is hugely helpful. It provides us the evidence for this sort of action needed. And the law, of course, can help provide that path to turn that evidence into serious accountability and serious action to protect human health of current and future generations. Thank you.
Brilliant, brilliant. That's a great start, Laura, and thank you so much for underlining the importance of legal instruments. We often forget those in global health. Very, very underappreciated and important. Thank you. Mariangela, over to you.
Thank you. Richard and Marina and everybody, Estella, thank you so much for giving me the opportunity to speak today. You know, it's not only because we are hosting COP30 in a couple of weeks, right? Which is very politically relevant because it's happening in the Amazon region, which is very much affected by climate change, but also because we as policymakers, in the health sector, we are used to having to find solutions for things, you know, and this is helpful to have these conversations, and being at the COP30 with a health agenda is extremely important. Now, listening to the report, you know, the Latin American side and what Marina presented, I found it sobering, to be polite, but very depressing. You know, because it's actually we have to think of things as being actionable, not paralyzing. And when I see this big climate agenda, I get paralyzed, you know, but when I see what the health sector can do, I think we can do a lot. I'll stop here. Thank you.
Oh, that's brilliant, Mariangela. Thank you. And look, thank you to you and all of your colleagues for your leadership this year for COP30. It's really, really fantastic to see. Raji, let's turn to you. You've got a very good perspective as the Deputy Director General of Africa CDC, an increasingly important regional and indeed international organization in the global health firmament. Raji, your perspective, please.
No, thank you so much, Richard. Let me start by congratulating the team, Marina and the team. I think this has been excellent work, and your work clearly articulated the what, the where, the why, the when. But what is not clear, you know, to somebody like me that sits in Africa, where we emit the least, is the how. You know, for instance, we know that despite being the least contributor to this greenhouse emission, we suffer the most severe, adverse consequences of the climate change. For instance, we've seen cyclone, we've seen drought in East Africa, we've seen cholera affecting, 24 member states of ours as a consequence of climate change. We've seen, diseases, emerging and re-emerging infectious diseases that are climate related. In fact, more than half of those outbreaks are one way or the other related to climate change, you know. And Africa CDC, we have launched the climate change and health strategic framework, you know, that speaks to one, how do we finance, what it takes to have a resilient health system, you know, how do we build the necessary workforce capacity, you know, to be able to really, you know, adapt and put in place a resilient health system, you know, that can withstand some of the shocks that is coming from a climate change. We have also looked at what sort of governance, mechanism do we put in place, especially around One Health? What sort of research should we be looking at that will be able to allow us to deploy the so-called local technology, But again, thanks to that, this report, and we really look forward, sitting down, working with you to jointly agree on how do we move forward from this excellent report. Over to you, Richard.
Thanks so much, Raji. And to say this might come out further in the discussion, the plans for an Africa regional countdown are well underway, and the role of Africa CDC will be crucial in that. So thank you. Let's turn to Jeremy. Jeremy, great to see you again. WHO's been an absolutely incredible leader as well as partner in this whole field of climate and health. Your perspective, please.
So thanks for those very uncharacteristically warm words, Richard. And great to join the panel. And to get out of the start on behalf of everybody again, to thank everybody for the Lancet Commission. It is an honour to have been part of setting up this in 2017 and now joined from a different guise. And I agree with you, Richard. It has got better over time. And this is by far the best report. A few thoughts. And I agree with everything else that's been said, which is slightly wearing on a panel. But firstly, I think we underestimate how the world is at one of its great inflection points at the moment. When the decades of some degree of agreement on very many of the issues, of course, disagreement on some and conflict on others, but nevertheless a consensus. That consensus is in the midst of being challenged at the moment. And it's important to, I think, appreciate that as a non-historian. The world doesn't go in a linear way. I think Lenin once said, weeks happen in whatever it was, about lots of things happening in a week and then nothing happening. You occasionally have these inflection points. And you should not look back in history and say that was an inflection point, because you've missed the opportunity. And this inflection point is now, and what we do collectively and individually in any leadership position we're in, organization, institutions at the moment, will really matter. Because what is done now will define the next decades. And it's not, this window of opportunity for action is not going to last very long, number one. Number two, there was a brilliant quote I came across recently from a previous Nobel Prize winner. The opposite of love is not hate, it's indifference. And one of the great challenges of the populist movement at the moment is that they've been better at making everybody indifferent to stuff that really matters. That you almost give up. It's nihilistic. You just have no hope. And any hope that you've got is extinguished because it's usually framed as something negative that's going to happen. We're going to take away your ability to fly. We're going to take away your ability to have a car. You're going to have to eat vegetarian food when you want to eat meat. We've got to reframe and learn from the populist approach and the narrative and reframe it in a way that is evidence-based and scientific, but which speaks not to some abstract concepts of what happens 10 years, 20 years, 30 years from now, but what is happening now. And I don't think we in the scientific community, we've been too elitist, we're not very good at doing that, and I think we've spoken in too abstract terms. And I think we've got to learn from people who are challenging things on the other side in the best way forward. The other comment, and then I'll stop, we do have to reach out beyond the bubble of our affinity groups. We have to, because this is not about a 50-50 balance that climate change is happening or not, and you have to have 50% of a panel that believe in it or don't. But we have to realize that not everybody is signed up to this agenda. There will be people and countries who will never adopt. There'll be countries in the middle and people in the middle that can be persuaded one way or the other. We've got to reach out beyond the people that are talking like us, and we have to reach out. And that was one of the experiences not only of recent political events, but also having lived through Brexit many years ago. And then finally, institutions really matter. The Lancet matters. Very pleased to be able to say that. The welcome and the systematic undermining of institutions at the moment is one of the actions being taken. And that is to, again, destroy this sense of trust, destroy the sense that love and hate are the opposite. It's not, it's a difference, and destroy the sense that there's any hope. We have to respond to this, and this inflection point in history at the moment, I think, is absolutely fundamental.
Jeremy, that's great words from you. Thank you very much indeed. Great to have you in such a senior position at WHO. You know, WHO's suffered some beating in the last number of months, but actually, I really think this is a moment where WHO can stand up and really say what it means, do what it wants, with a freedom that perhaps you haven't always had in the past. And so it's great to hear you say that. And I've certainly heard Tedros speak very frankly about other issues. And so all power to you. Marina, I want you to have a comment about yourself.
Oh, Richard, what else can I say? Look, this year's report was by far, I think, the hardest to write, not because of how technically complex it is, but because of what Jeremy was just saying, because of this point of inflection, because of how we're seeing that consensus that we've been leaning on and that we've been pulling on to encourage action is now being challenged, how the science is being challenged as researchers. That really touches us very, very closely. And particularly because of the reversal of progress. Just when we were asking for a bit more, saying progress is too slow, now we're saying actually progress is being reversed. So that takes us to a very dangerous situation. That takes us to a world that is now really at a pivotal moment. And we've been coming from the COVID pandemic, we've been coming from crisis to crisis up until today, where the world is trying to find its identity again. And it's getting to a point where I think to some of us that have been reading about this for so long, becomes quite familiar, in that as climate action becomes challenging, and as we're challenging power, as we're challenging big corporations that handle a lot of power, things are getting increasingly challenging. We're seeing increasing attacks on science. We're seeing increased populism, and we're seeing trends towards nationalism that become really concerning. So in the report, what we've done this year is pull together a panel, which Richard, your team has been lovely because it's way too long. We generally try to keep panels to 1 page, and this one goes through 3 pages. But we've tried to synthesize what we think that different actors could actually be doing to support action, often in spite of what national governments are doing. We know that health systems, and Raji was just alluding to these, health systems are so important. Mariangela also mentioned how so much can be done by the health sector in terms of adaptation. Health systems in many countries haven't achieved universal health coverage. So how can we bring together synergistic agendas so that when we put our actions together, we deliver those enormous and synergistic benefits of tackling climate change with health at the center of our actions. We've also seen how the transition towards clean energy is delivering so many benefits, and that being challenged, we hear it in the news over and over again, that misunderstanding that fossil fuels are where the economic benefits and economic prosperity lies. History has shown that not to be true over and over again, shown that the spillover effect of big industry is not really benefiting local populations, and that we do need to rethink how we distribute climate finance so that it reaches the most vulnerable communities, how we redistribute knowledge and technology in a crisis, same as we've seen happening and not so successfully during the COVID pandemic in vaccines. We need to see the same happening with clean energy as a social good. And that requires a transformation of how we think about these issues. But as we've heard, it seems almost too big, and action happening bottom up by local communities, it was really showing how this becomes reality. And very many inspiring examples of that we've also featured in this year's reports.
Thank you very much indeed, Marina. Now, I want to move on to the key messages in the report and to have some questions around those key messages. I want to focus on 3 messages in particular. The first one around delays in climate change action that are costing lives and livelihoods. A second key message on backsliding, and then a third key message, a more hopeful one, on climate change action offering a lifeline. So let's start off with the first, really talking about how climate change is affecting health. So let's establish a foundation of facts first, because facts lead to truth, truth builds trust, and hopefully trust can then help shape our shared reality. So let's get the facts right. my question to you all is, from your perspective, how are you seeing climate change affecting health? And I'm going to start, if I may, with Mariangela, because as the host of COP30, there you are in Brazil, massive country, many challenges, and we heard them beautifully, if that's the right word, set out, alarmingly is a better word, set out by Stella. From your perspective, Mariangela, how do you see the impacts of climate change on health?
You know, Richard, thank you. I think one of the things that's important of what I've been seeing in Brazil since I came back to the Ministry of Health is a change in behavior from health policymakers from state and city levels. You know, for example, a very concrete example, we do the emergencies, not only the environment, the Ministry of Health, but we coordinate the emergency response, right? And then we have like the contingency plans that we work with states and city level authorities. These contingency plans, there is now a contingency plan specifically for climate emergencies. So this means that I think it goes in the direction of what Marina presented on cities taking more responsibility. It's not only cities, it's states as well, because we had two major events in the past year, three maybe major events. In 2024, we had an extreme heat event in Rio, where people died, 52 degrees. So that led for the organization at the city level of an emergency response connected to the emergency response from the city of Rio. Now, maybe you saw in the news, there's another emergency in the city of Rio related to drugs and anyway. And then we had this huge flood in the south of Brazil, last year as well. So, and this came as we had dengue fever coming up as a huge outbreak in Brazil. So there's more awareness, that there is a need to act on this from the different level of health authorities. And then we do have like a national plan for climate change, right? The Adapta SUS. SUS is the national health system, unified national health system. And this led to the Belém Health Action Plan, right? Because we are moving. So there's more awareness, and the Brazilian COP presidency is very much pushing for action-oriented solutions, right? So that's where we are right now. So there's more awareness, there's more understanding also, and I think the Lancet report helps, because if we have better information, it should lead to better decision making in public health policy. It should lead to that. It should. It doesn't always, but it should. Thank you.
Yeah, Mariangela, I'm really glad you underlined Marina's point about local action. And it reinforces actually a message from one of your compatriots, Cesar Victora from Pelotas. And
Pelotas,
Cesar gave a lecture recently in which he said we should invert the think global, act local, and he said it should be think local, act global. And I think that's really interesting that you can make such a difference at the local level, and we shouldn't be waiting for all the people at the G20 summits and in the World Bank and wherever to be the ones to be making the decisions and actions first. We have the agency. Agency lies with us. So great that you.
Cesar is a good friend, okay? Cesar is a good friend, and he's also in the region of Brazil that had this historical flood, right? Rio Grande do Sul, Pelotas was affected by that. So
right, I
anyway.
didn't know that. Well, yeah, no, he's a hero. Raji, I want to turn to you. There you are in Africa. And very much at one of the epicenters of the climate emergency. From your perspective, at the region's foremost public health agency, how do you see the climate crisis affecting health?
Thank you, Richard. Let me start by saying that from Africa CDC perspective, the climate crisis is actually health crisis. I think we need to be very clear on that, and I know that DG Tedros, has emphasized this several times. What we are seeing on the continent is the fact that climate change is having profound and far-reaching impact on human well-being. As we saw in 2023 in the Horn of Africa, today a lot of those kids still remain very stunted. We've seen what happened with the cyclone, with a lot of, cholera cases affecting, more than 20 of our member states. We have also seen that if we do not do anything, we're likely to see additional 14.5 million deaths, and in terms of healthy life lost, we are talking of 2 billion, and economic losses, this is also very, very huge. We're talking of 12.5 trillion, in economic losses by 2050, if we do not take, action. And as Africa CDC, we took time to review the disease outbreaks, in the last 20 years. And 50% of those outbreaks are actually linked to climate change, talking of Ebola, the Mpox, yellow fever, and so on and so forth. And we're also seeing shifting, in disease pattern. We are beginning to see dengue where such was not occurring before. We've seen malaria in places where they're supposed to have been eradicated, so the impact is really huge. And this was what actually informed the decision to come up with that climate change and health strategic framework, which actually emphasized, the importance of the need for sustained investment, the need for climate financing, the need to really engage community, which you've clearly mentioned the need for really think global and act locally. And of course, we need to find a way to hold ourselves accountable, because if it's not get measured, it doesn't get done. And much more critically, we know there are so many partners, as far as this climate action is concerned. The big question is, how do we work together? To ensure that there is no unnecessary duplication of effort, and much more importantly, bringing our differential strength into that particular space, to address some of these issues. And with this new report, I want to believe that we can always sit down and look at our strategic framework and this new report. How do we work together to make sure that we are able to really action some of the action points, as recommended in the new report. So let me stop here, Richard.
That's great, Raji. Thank you. Let me go back then to Laura. You have a more global perspective, I think. From how do you see the impacts of climate change on human health?
Thank you. Well, they are enormous, and as we've heard in detail in this report, and they are obviously manifest in different ways in different parts of the world. But it's absolutely clear that the climate crisis is a human rights crisis. And so the question then for us as an organization that focuses very much on what are the right laws that you need in place, what are the right regulations that you need in place, is, well, what needs to be done? How can you enshrine in law in terms of state obligations that the requirements needed to protect people's health from climate impacts? And of course, an enormous amount of work is needed to be done. We need to accelerate the work on mitigation. But while we still have, some governments and fossil fuel companies, pouring fuel on the fire, as Helen put it, we need to also really scale up what is done in terms of adaptation. And so really having adaptation plans that are funded and fit for purpose, heat plans, for example, within that pay particular regard to old people, infants, pregnant women. So we really, really need to make sure that the infrastructure is in place for what is already and perhaps unstoppably, I'm afraid, a rapidly warming world. And I think that's really where we focus. What is the regulation that's needed? What are the government's obligations needed? And importantly, what are the human rights obligations of corporates? Because they do act actually, under the UN Guiding Principles on Business and Human Rights, there are human rights obligations on big corporates.
Yeah.
And if you are financing fossil fuel expansion, if you are doing fossil fuel expansion, then you are in fact complicit in widespread human rights abuses caused by climate change. And we're increasingly seeing accountability, or at least litigation trying to pin that accountability on big corporates that are the big polluters and responsible for so much of this.
Yeah, why these legal instruments are so important as a partner to public health. Exactly, on the accountability front. Absolutely. Thank you, Laura. Let me go to Jeremy as well. I mean, again, you have a very broad perspective there, Jeremy, and as chief scientist in your previous role, you will have been very concerned with these issues about the actual effects of climate on health. Your view from Geneva?
Yeah, so I think it's been said on the health issue. I mean, the vector-borne, the dengue, I totally agree. Dengue is going to come to much parts of Africa, and the pressure on the health systems are going to be absolutely devastating. So I absolutely agree with that. But it is not just about infectious diseases. Pregnancy, mental health, non-communicable diseases, premature aging, and with demographic shifts, these are going to become increasingly important in every country and every jurisdiction. So we shouldn't just limit ourselves to the impact on vectors and infectious diseases. Second thing is, it's easy to frame this as a crisis, and the emergency impacts, as Mariangela said, are critical, and they can be a catalyst for change. If we constantly focus on emergencies, my worry is that ministries within government will say, well, I'll deal with it when there's an emergency, and maybe I won't be minister when that happens, and so it'll be the full person won't be me, it'll be the next Minister of Health. If we only focus on the symptoms, the emergency, and we don't address the underpinning drivers of those emergencies, biodiversity loss, climate change, urbanization, the rest of it, then we're going to continue to be reacting to the symptoms. And it is so easy in government to say, I'll wait for the emergency and then deal with it. Or, as I say, maybe it'll be the next minister that has to deal with it and I'll be doing something else. So I worry about this focus on just emergencies and reactive change rather than sustained change underpinning. Third thing is health in many countries should be the most powerful ministry, but of course it isn't always the most powerful ministry. And the half-life of your average Minister of Health is relatively short. So unless we see this as a cross-sectoral activity across all of government, then we're not going to make that much progress. And the problem in our world, and one of the great problems I think in global health, is how we're going to shift from a vertical set of structures into more horizontal thinking, and where does accountability rest when you work horizontally? And I think that is one of our great challenges beyond this issue and beyond others. And then lastly, I could not agree more. Legal issues, legal approaches are absolutely critical. And any undermining of legal institutions within countries is really dangerous. And so where we work in the health sector, making sure that our colleagues in the legal structures and the institutions which they represent are robust, are protected, and serve the communities which they're supposed to serve is crucial. And look back over history and see how often it's actually the legal structures which get undermined and the legal institutions as a route to autonomous power. So it's not just the health sector, the legal conduits are really, really important.
Thanks, Jeremy. Great words. Marina, anything you'd like to add to that briefly?
So look, one of the things that we allude to a bit in the report, but to us is really difficult to quantify, is the overarching health impacts of climate change when it comes to the deterioration of the underlying supportive systems. And I think that goes to what Jeremy was saying. Much of the impacts of climate change on health will come from stressors on our water systems, on our sanitation, on our food systems, on our social systems, and triggering those social tipping points. And protecting health from those hazards requires health to be at the center of the conversations when it comes to how do we respond to climate change. Much of the health protection will not happen through health systems, but will happen through all of these other systems that health so acutely depends on. So ensuring that health professionals are sitting at the negotiating table when we talk about how do we respond to climate change, when we talk about how does our food industry support a healthy future, healthier societies, how do we tackle what we call the commercial determinants of health, those kind of commercial systems that undermines people's well-being directly and indirectly. So I think what we're asking for here is that in this moment of a global crisis, we need to rethink how we shape our futures to be healthier. And that will help us not only when it comes to climate change, but also when it comes to many of the other global health inequities that the global health community has been trying to tackle for so many decades.
Okay, thanks, Marina. I think we've established a baseline of facts here, but now I want to move on to the second key message of this year's report, and that is on backsliding, and the backsliding that's putting people and communities in harm's way. So a very simple sounding question, but with a very complex answer, I'm sure. But we've got an audience here who want to know, how do we maintain momentum? How do we protect our credibility? What do we do at a time which is, as Jeremy said, an inflection point? People want guidance. So I want you to give us some thoughts about what we should be doing in the face of this rather adverse political environment. So I'm going to go first to Raji, sitting in Africa. You're a steward of public health over a huge continent. What do we do, Raji? Help us.
Thank you, Richard. I mean, let me start by saying that the framework is not, I mean, the Africa CDC framework on the climate change and health is not just about emergencies, as Jeremy rightly put that. You know, we're also looking at NCDs, we're looking at mental health, we're looking at water, sanitation, and hygiene, you know, as part of those adaptation, you know, that will allow us to be able to withstand some of these shock that is coming from climate change, including building the necessary, capacity by way of workforce development. Now, to your question, Richard, how do we maintain and sustain the momentum? I think number one here is around getting the necessary political buy-in, you know, really leveraging that, the political leadership of the continent of Africa. And I'm glad to say that when it comes to climate change and its impact, you know, on health and other sectors, the AU has gone a step further by making President William Ruto, you know, as champion, you know, for that agenda as far as the continent is concerned. And as we all know, most of these, the climate action in some of our member states actually resides within the presidency, so that they can actually bring what it takes to coordinate all the sectors, you know, that involve one way or the other, which take me to the second point, which is around the whole of society approach. You know, there is no one sector that can do this alone, in as much as we continue to say that the climate crisis is health crisis. The health ministry cannot resolve this alone. We need the environment, we need the agriculture, we need the finance. You know, in fact, we need the parliamentarians, because when you talk of the legal aspect of this, the climate, change, you need the parliamentarians, you know, to be on board. So number three is around sustainable financing, because whether we like it or not, we need to find a way to finance those, what it takes to adapt, you know, to the climate, change. And much more importantly, what it takes to put in place a primary care system that is both pandemic or epidemic ready and climate resilient. You know, so you need that sustainable financing, you know, to be able to do that. And number four is around partnership, which for me underpin what we are doing here today. You know, the key stakeholders need to come together. You know, we need to come together and sustain that momentum. And we need to do it collectively, you know. I think this is where we need that global solidarity, especially looking at the low and middle income country who are emitting the less, you know, but bear the greatest brunt and has not much of what it takes, you know, to adapt, you know, to the impact of this, climate change. So I think that partnership is critical. And of course, last but not the least is we need science, we need, the data. You know, we've seen the global countdown, and I'm happy that, Richard, you did mention that the Africa countdown is in the pipeline, you know, so that we're able to generate evidence, you know, that is informed by the local context. You know, I think this is really, critical going forward. So let me stop here and hand over back to you, John.
That's great, Roger. Just to clarify, so President Ruto is, of course, the president of Kenya.
Correct.
So is he the African Union kind of ambassador for climate change? Or
Yeah.
Just say a little bit about that.
Correct. So at the level of head of state, we call them champions. So he's the one championing the climate, change and what action that is needed, you know, to mitigate and adapt to that as the continent is concerned. And we've had two separate summits. As you are aware, the last one took place some few weeks ago in Addis Ababa, the Africa Climate Summit. Over.
Great. Thank you, Reggie, for clarifying. That's excellent. That's the kind of leadership that we need to be seeing on every continent. Great example. Mariangela, how do we maintain momentum and protect our credibility at this time?
You know, just listening to Raji, it's very sobering as well. You know, to think of the breadth of what we need to do. You know, I'm a true believer that the Belém Health Action Plan could help us. You know, and could actually show the way when you ask what people ask and how do we respond. I think if we keep it simple, and that's my plea to the global actors, you know, let's keep it simple, because it's very difficult when you have like 80, 100 indicators to report on. It scares the policymakers, actually, right? So I think the way ahead is that, at least in the health sector, that we have, you know, these milestones, this very, very soft type of agreements that can help us move this agenda forward, you know, and this is what we should do right now. And just to say that the Belém Health Action Plan does not only comes from the Brazilian experience, it's also a build-up from the Baku coalition that Marina referenced to, and through the attached WHO led initiative, you know, because this is building on momentums, and we are putting health on the climate agenda, and at the same time that we want the climate agenda to understand health, and that we can work together. I think that's the way forward, at least on this vast portfolio, the health sector. If we have a plan, we should move with it.
No, I love that. And your point about keep it simple, I couldn't agree more.
Yes.
One of our failures as doctors and scientists and health workers is that we end up coming up with a laundry list of 50 recommendations for every organization under the sun, and it's instantly forgettable. Whereas what we need is a story, a simple story with a beginning, a middle, and an end that we can tell people, that we can remember, and that others can remember when we tell the story. Really, really important point. Thank you very much. Laura, keeping our credibility at this time, thoughts?
Thank you. Well, to add to what others have said, I'll just highlight three things. One is the importance of national climate legislation as a way of closing that gap between the international commitment and real world action. And we know that those countries that have got climate laws do much better in terms of reducing emissions and creating a safer climate. The UK, for example, has reduced its emissions by 54% since 1990, and that's in large part, thanks to its Climate Act. And if you get the right national climate laws in place that provide for mitigation action, adaptation action, health and health protection plans, that really provides that certainty needed for society, for business, and it galvanizes an all of society, business and economy approach, which is really important. So we're advocating on the back of the ICJ advisory opinion on climate change for more countries to have that sort of legislation or to update their existing legislation. The second thing I'd say, which is really critical, is we have to tackle misinformation. You know, this is also an information war, right? And so what we're seeing is all this action by the incumbents of the status quo to really try and delay climate action with misinformation, to cast doubt. You know, that statistic that I said about the UK having reduced emissions by 54%, how many British people know that? You know, we're not communicating the successes, and actually the narrative is being hijacked by those that want to delay and prevent the action that's needed. So that's about the information wars, communicating success. And my third point is, how do we galvanize individuals and make sure that more people feel that they have agency? Now, litigation is one way that communities can have agency, but it's not available to everyone. You know, what else? So I heard this amazing story about citizen scientists, you know, communities who are given air quality monitors, and they're all then recording what's going on in terms of air quality or heat or whatever, and feeding that in to wider action. Energy communities, where local communities get together and they invest together in local renewable energy. That's incredibly powerful. And then what do individuals do in terms of their pensions, their investments? You know, well, how do they scrutinize where their money is going and what it is funding? So there's a huge amount there that we need to, you know, I think in different ways through different channels, help individuals at grassroots level, at citizen level, feel like they have agency, because one of our biggest problems with this polarization is a sense of helplessness, not being able to play a role, and having, you know, some sort of transition forced on them. I'll stop there.
No, that's great. 3 very actionable actions, if I may say. Thank you very much indeed, Laura. And then Jeremy, come on, help us, save us.
Tricky coming last because you agree with everything that's gone before. A few additional complementary thoughts, I think. I think many governments in many countries at the moment are feeling the pressure of a disconnect between their warm words and the reality of their ability to change people's lives for the better. And there's a growing disconnect there. So and part of that is, I think, keeping it simple, as you said, and being too abstract in what's trying to be offered, maybe too grandiose sometimes, when actually people just want stuff to work tomorrow morning rather than thinking what's going to work. So going back to families, to communities, and using that, and ultimately most politicians in elected jurisdictions or not, ultimately do respond to their communities. I'm all in favor of youth, of course, but youth don't vote. And so let's not forget senior people who turn out and vote on things and the power that they have to influence policies. And whilst we embrace the talk of the next generation and the rest of it. Secondly, evidence will, and quality of evidence will still matter. You have to believe in that. If you give up on that, you might as well give up. And therefore, the worst thing, going back to my comment earlier about indifference, is believing that quality of evidence and data, and don't give up on that. That's why the Lancet Countdown is so important, because it's putting the evidence out there. And even though you may think you're banging your head against a brick wall, it is crucial to keep doing it and challenging yourself to make 2026 one better than 2025. Yeah. It is no good saying we were better than we were in 2017. It's not about being better than 10 years ago. It's about being better tomorrow, not yesterday. Learn from the communication strategy of others, even if you may not like them. Communicate successes much better and the narrative behind that. And then this whole issue of agency, which I do completely agree. I think people are in the nihilistic, indifferent, cynical world thinking they do not have agency. I don't believe that. It's just where that agency is affected. And secondly, for those who do have agency, which I think is more than people recognize, there is a responsibility to use that agency. You can't be given or have agency or privilege There's then the responsibility of using it.
Thanks very much indeed, Jeremy. And let me just remind the audience, there is a Slido question box on your event platform that you can put in questions, although time is slipping away from us and I still have one more question to go for the whole panel. But let me just turn, Marina, actually, you have the final word on this particular question.
Yeah, Richard, look, one thing that to me has been quite inspiring is seeing some of the surveys that have gone out to the general public. There's a survey that went out to 77 countries asking people around the world what they thought of climate change action. And overwhelmingly, 80% of people support more ambitious climate action from their governments. There's also a survey that went out to leaders of organizations, C-level leaders, and anonymously they responded that they would support a much faster transition to clean energy and to net zero. So I think this wave of denialism feels very overwhelming. It is very loud. It is happening very suddenly, but it's important to remember that most people still want what's best for their health, what's best for their future and for the future of their children. So the support is there. I think we're seeing the counter movement, the typical cultural counter movements that come after big movements for action. And what we need to remember is that the pressure, the support from people to live better and to have healthier lives is still there. Another point is we mustn't be naive, though, about what people on the ground are feeling and what they're going through. There is an energy crisis. There's been a lot of the conversation around climate action that has neglected or left people aside for many, many years. So that's why it's so important to put people's health back at the center of how we tackle climate change. We could do this in ways that are detrimental to people, or we could do this in ways that deliver huge health co-benefits. And designing those actions that maximize the benefits to people's health is where now we have to focus our efforts, and ensuring that we're supporting livelihoods, that we're supporting people on the ground that are facing the impacts, and that our actions are built with local communities. I think to Mariangela's point, Brazil is putting a lot of focus on community co-creation, and that will be crucial. We cannot leave communities aside.
Brilliant. Thank you very much, Marina. We've got 4 minutes left, so you're under a time pressure. And the third and most important optimistic conclusion of this Commission report this year is that climate change action does indeed offer a lifeline. And I want to just turn to one question we've had from our audience. And I'd just like to thank Vanessa Oliveira from UMSO Planeta, a solution-based focused journalism platform, for this question. And it means that I'm going to begin with Mariangela here, because it's about you, or at least Brazil. And then everybody else can weigh in. And the question is this, and it's a very good question. What would be the most meaningful legacy of COP for COP30 in Brazil that it could deliver to advance the climate health nexus? And how can Brazil, as the host nation, help make that a reality? So, Mariangela.
That's a very good question, actually, because it talks about now and the future, right? And I think Marina and we have discussed this in the past. Actually, it's I think the most meaningful legacy that we can leave from the health sector is the Belém Health Action Plan. And our hope is that next year, whoever hosts the next COP 31, right? The climate COP, because there are other COPs, right? But it's that next year we are able to report, maybe be a health day, and also report on progress made or number of countries who have endorsed the plan, right? That kind of thing. Mm-hmm. So from the health sector, we need to firm our position and make sure that we are able to report in every COP, even if it's a process report. It's not heavy indicators and so on, but there is growing interest. And as that's the last time I speak, right? So let me say two things. Yeah, two things. When Julia Gillard, right? She mentioned in the beginning, we need to speak in ways that reach people who we are not reaching, right? I think that we are preaching for the converted. Even here in this panel, everybody's converted. We all think alike
Yeah.
in the last thing as I get older, I starting to enjoy Pink Floyd more and more, and there's a song.
That's very
Even my
dangerous.
sons, they know
Yeah.
Pink Floyd. But there's a song, Hey You, that says, "Don't tell me there's no hope at all. Together we stand, divided we fall." So this
Beautiful.
is what we need to
Beautiful, beautiful,
focus
beautiful.
on.
Thank you. Now, everybody else, you've got literally 15 seconds each before I get shot for coming in after time. Jeremy, 15 seconds on your hope for COP.
Make it relevant to people's lives and counter indifference.
You are a star. Thank you. Raji, 15 seconds.
No, thank you. I think for me, we have so many existing pledges. So the question is, how do we translate these existing pledges into concrete actions that speaks to health, speaks to finance, and speaks to energy? Thank you.
That's good. That's good. Thank you. Laura, 15 seconds on COP30.
Thank you, How. I think health is one of the best ways through to climate action. It matters so much to humans. It's not political to want to breathe clean air or live in a safe and stable climate. And so really, pushing this evidence and these arguments to really compel governments and corporates to take more action. That's what we need.
That's brilliant. Thank you very much. Well, look, I'm going to turn to Marina in a second, but I just want to thank an amazing panel. Thank you so much. It's such a privilege for me to see you all, meet you all virtually, to listen to your wise words. You've done a brilliant, brilliant job today. Thank you. Now, Marina, I didn't give you the chance to answer about COP30 because I also want you to do something else, which is tell us a little bit about the future of the Lancet Countdown, because this is a very exciting moment for the Lancet Countdown. Welcome, thank you, Welcome has given a tremendous vote of thanks and support for your work, is continuing to invest in the program, and that's giving you a new life. So Marina, take it away. What's the future like?
Thank you so much, Richard. And as you said, Welcome has very generously supported once again the Lancet Countdown through an expanded program of work, which we announced last year during the launch of the report of 2024. And what we have now is an increased ambition with regional centers being strengthened and delivering their own reports. You just heard from Stella Hartinger, who is leading our Latin America report, and that report is published today as well as the global report, and she already mentioned this a bit, but she will be sharing some of the findings alongside other panelists in just a few moments. So do join that event today and check out their report online. And we will also be publishing very shortly on the 31st of October for Halloween, the Asia reports. So our Chinese colleagues have developed this report focusing in China, taking stock of health and climate change in China, where we've seen a lot of progress, a lot of impacts, and a very, very interesting report also coming out from them. So do stay tuned, and they will have a launch event on the 31st of October. And you can see that QR code also to join the event online on screen. And then turning to something that has us all very excited at the Lancet Countdown. Many of you in the audience have for many, many years said, what happens with the Lancet Countdown Africa? You don't have much presence in Africa. We have very few African researchers within our global collaboration, and we do want to fix that. We do think that the voices of every person all around the world need to be reflected in a global report. And we especially think that Africa needs to be front and center, not only because of how enormously impacted Africa has been from climate change, a crisis to which it has barely contributed, but also the inspiring action happening across Africa, the knowledge on the ground of how to face the impacts of climate change, and the wealth of knowledge and power of local communities. So the Lancet Countdown Regional Center for Africa has been launched earlier this year. And I'm going to share now a few words from the director that will tell us a bit more about the work that he's doing in finding our working group leads to pull the working group collaborations together. So I think we have a message from him that we will listen to as well.
Hello everyone, Tafadzo here, Director of the Lancet Countdown Africa Regional Center. Just here to tell you that we've posted a new job vacancy on our website. Please head to the Lancet Countdown website and please apply for this opportunity. We look forward to receiving your application.
So there you go, Tafatswe, the director of the Lancet Countdown Africa. We're looking for local researchers that can help pull together our 5 working groups. So if this is of interest to you, please do scan the QR code and do share the news, as we are very excited to be pulling that collaboration together. And I also wanted to share, alongside the global report, we're publishing a lot of country-level products that were mostly, in most cases, co-delivered with local partners in different parts of the world. We have policy products, we have data sheets, and we're hoping that these could be useful to local actors as we seek to harness action on the ground. So do check in at lancetcountdown.org for some of these resources available there to you as well. And I also wanted to share, we receive a lot of feedback about what we are monitoring, what we're not monitoring, how to best monitor. And we've heard a lot today from Richard, from Mariangela, from Jeremy, about how important it is to make things simple, to monitor the important. We have an ever-proliferating list of indicators that come from an increasingly complex intersection between climate change and health. But we do want to ensure that we're capturing the most important science, that we're capturing what speaks to people on the ground the most. So we're holding an open consultation where you can let us know about what you think are the most important indicators or issues that we should focus our efforts on, and that we should promote research on. There's a lot of research still needed at the intersection between climate change and health. And once again, I know that the Wellcome Trust is a huge driving force to bridging some of those gaps. And with that, I just want to close by thanking a few people. I couldn't possibly thank everyone that has contributed to this year's report, but special thanks, obviously, to Wellcome. Without Wellcome's generosity, the Lancet Countdown would not be able to happen, and their trust, their strategic collaboration and support is fundamental to our work. Special thanks to the Lancet. You're not just an editor, but you're actually the power behind everything that we do. The work of the Lancet is enormous in how they help shape our reports, our science, how they ensure the rigor of our science. So huge thanks to you, Richard, and to all the team there. UCL has been the home of the Lancet Countdown since inception, and the Institute for Global Health is a very powerful and rich community that has made the Lancet Countdown thrive within the university. So big thanks to them as well. They have also led with a huge number of contracts and administrative burden that should be recognized, all the efforts of UCL there. I also want to thank the World Health Organization. I said this report is done in partnership with the World Health Organization, but I don't think that does justice to just how important the World Health Organization is to the Lancet Countdown, but to health and climate change as a whole. The World Health Organization now has climate change as one of its 6 strategic priorities in the new global plan of action. And that has meant a transformation in how health professionals engage with climate change and how they're taking the evidence that we generate and supporting countries in the delivery of health-centered climate action. Big thanks to the team that I know is overstretched and facing certain attacks at the moment. Their support is incredible. I want to thank also our panelists, from the keynotes through to the panelists. It's been inspiring to hear you speaking about the findings in this report, your reflections. And I think you brought to life some of the data that we show and gave us a lot of inspirations of how to go forward from here on what is a pretty depressing report. I will agree with Mariangela, but a report that also shows a lot of momentum and how much can be delivered at the local level. So a few different pointers there towards kind of community-led action and action bottom-up. I'll thank also the board that is chaired by Helen Clark, who has been absolutely wonderful, and the Lancet Countdown Secretariat. A lot of people deserve holidays after this. So big thanks to everyone that has worked to make this happen. And of course, very, very many thanks to the 128 authors of this year's Global Lancet Countdown report. They are some of the world's leading scientists. They're very, very busy people, and they put so much effort each year in making sure that our science evolves and that these reports can land just before COP to ensure that we can inform evidence-based action for health. And of course, the 300 contributing researchers that make the Lancet Countdown and its regional centers. And with that, I'll hand over with particular thanks back to you, Richard, for all of your support throughout the years.
It's a pleasure. Thank you, Marina. I've just got a few words to say. First of all, why the Lancet? Why are we involved in this? Well, because we are a scientific journal, and what you have heard today from Marina and others is the best available science there is that we have at our fingertips on climate and health. And yet, look at some of the headlines that we've seen around the world just in the last few months. Let me quote a few. Climate cultists to blame for rising skepticism. Beyond doomism on the misguided rise of climate fatalism. Or how about this one? Net zero is the most costly self-inflicted wound in modern history. So that's the inflection point Jeremy is talking about. That's the backsliding the countdown is writing about. And only yesterday, it was reported that Bill Gates, a man I usually admire, revere, even sometimes love, is arguing that climate change will most definitely not be the biggest threat to people's lives and welfare, which is exactly contrary to the conclusion of the two previous Lancet commissions in 2009 and 2015 on health and climate change. The two commissions, indeed, that led to the Lancet Countdown. He argues that poverty and disease are much more important than climate and health. Now, as you've heard in the last 2 hours, his view and the views of those who claim that goals such as net zero are unnecessary are, I'm sorry to say it, dangerous and complacent. And they reflect this broader reversal of progress that we've seen in raising awareness amongst politicians and policymakers to the dangers of the climate crisis. There is a curious, indeed it is a mysterious willingness among some observers and commentators to discount the effects of climate on human well-being. But please let us be very, very clear that our warnings are not doom mongering. First of all, we should not be pitting climate against disease. We shouldn't be pitting heat versus poverty. It's the intersection of risks and their effects on human health that matters. So please, no false dichotomies between the challenges that we face. They are unhelpful, they are perilous at this very important pivotal moment. Second, the health burdens, as you have heard, are not small. Let me give you one additional example. Work that we published recently showed that over 20 years, 2000 to 2019, over 1.5 million deaths from just landscape fire-sourced air pollution alone. People are dying from the effects of climate-related issues. So don't discount them. And third, also don't discount the impact on health systems, which is forecast to be substantial. There are already and will be increasingly increased hospitalizations from rising temperatures, with particular vulnerabilities for older citizens, for children, and for adolescents. So this is going to put huge stress on already stressed health services. So the reality is, as much as so many people don't want to hear it, we need urgent action on mitigation and adaptation now. And this year, the Lancet Countdown report explains why. Repeats, as Marina, a big thank you to her, a huge virtual hug to you and your team at UCL for what you've done, to all the collaborators and partners, especially WHO, the Wellcome Trust for their support, and of course my colleagues at the Lancet. I don't do any of the work, it's them who do all the work. A big thank you to them for the peer review and preparing the report for publication. Back to Daisy.
Thank you, Richard, for some rousing final comments. We really hope that everybody who joined today enjoyed themselves and learned something new. And we hope that you keep engaging on the topic of climate change and health as we head towards COP30. I will be there for Carbon Brief, reporting on the negotiations, and I hope to connect with Marina to speak more about this report and anyone else who's attending who's interested in this topic of climate change and health. Final housekeeping note, there is a Slido survey that you can complete to offer us your feedback on today's event. And the final thing to say is just a massive thank you to all the speakers and for everyone that joined on the platform. And I wish you a great rest of your day. Thank you.